and delivery explained, stages of childbirth and what to expect. After months of waiting, the big moment has finally arrived. Labor and delivery are the final steps in bringing a new life into the world. But what really happens during childbirth? Let's break it down. Fetus in the womb preparing for birth. Labor is the process that helps the baby move from the uterus to the outside world. It usually happens between 37 to 42 weeks of pregnancy and is divided into 3 main stages. Stage 1 labor, Stage 2 delivery, Stage 3 placenta delivery. But before labor begins, many women experience signs that their body is preparing for birth. Signs of labor. Pregnant woman experiencing these signs. Labor doesn't just start suddenly. Here are some early signs to watch for. Lightening. The baby drops lower into the pelvis. Braxton Hicks contractions. Mild, irregular contractions that prepare the uterus. Mucus plug loss. A thick mucus discharge, sometimes called the bloody show. Water breaking. The amniotic sac ruptures, releasing fluid. Strong, regular contractions. The biggest sign that labor has truly begun. If contractions are 5 minutes apart, lasting at least 1 minute, and continue for 1 hour, it's time to go to the hospital. Show a clock ticking to emphasize timing. Stage 1, the longest stage. Labor begins. Show the cervix dilating from 0 centimeters to 10 centimeters. Stage 1 is the longest part of labor and happens in 3 phases. Early labor. 0.4 centimeters dilation. Contractions are mild and irregular. Active labor. 5-7 centimeters dilation. Contractions become stronger, longer, and more painful. Transition phase. 8-10 centimeters dilation. The most intense part. As the body prepares for delivery, mother breathing deeply while her cervix dilates. During this phase, breathing techniques, pain relief methods, and support from doctors or midwives are important. Stage 2 delivery of the baby. A baby moving through the birth canal. Once the cervix is fully dilated, 10 centimeters, it's time to push. This stage can last anywhere from a few minutes to several hours. With each contraction, the baby moves further down the birth canal. Finally, the baby's head emerges, followed by the rest of the body. And just like that, a new life enters the world. Stage 3 delivery of the placenta separating from the uterus. Even after the baby is born, the process isn't over. The uterus continues contracting to push out the placenta, the organ that provided oxygen and nutrients during pregnancy. A doctor gently delivering the placenta. This usually happens within 5 to 30 minutes after birth. Pain relief options during labor. Labor can be intense, but there are several pain relief options available, including epidural anesthesia, a numbing injection in the lower spine. IV pain medications reduce pain but may cause drowsiness. Breathing techniques, deep breaths to stay calm. Water birth, laboring in warm water to ease pain. Massage and movement, walking or using a birthing ball. Every woman's experience is different, so choosing the right method depends on personal preference and medical advice. Meeting the baby for the first time. After all the hard work, the best moment arrives. Holding your baby for the first time. Skin-to-skin contact helps the baby feel safe and strengthens bonding between the parents and newborn. The baby gripping the mother's finger. This is also the time when the baby takes their first breath and lets out that beautiful first cry. Conclusion. The miracle of birth. Labor and delivery are unique for every woman, but one thing remains the same: the miracle of bringing new life into the world. If you found this video helpful, don't forget to like, share, and subscribe for more educational content.